World Organ Donation Day is observed on August 13 each year, and this year in 2025 it falls on Wednesday with the theme Answering the Call, as designed by the Organ Donation and Transplant Alliance. World Organ Donation Day 2025 date and theme. Organ Donation Day is a significant global observance marked annually to promote and raise awareness about the importance of organ donation. According to UNOS, around 1,39,093 people require a life-saving organ transplant, but the number of available donors is alarmingly low, resulting in a critical supply-demand gap. The day also seeks to encourage individuals to consider becoming donor and to pay tribute to the selfless contributions made by donors and their families. Question is, when is World Organ Donation Day observed every year? 13th August. World Organ Donation Day is observed on August 13 every year to spread awareness about the importance of organ donation. The first ever successful living donor organ transplant was done in 1954 in the United States. India has its own organ donation day that is observed on November 27 each year. There are two forms of organ donation: live donation and cadaver donation. National Organ Transplant Program is a central sector scheme implemented by the National Organ and Tissue Transplant Organization under the Ministry of Health and Family Welfare. Its primary goal is to improve access to life-saving organ transplant for those in need by promoting deceased organ donation. The NOTP aims to bridge the gap between organ demand and supply through various activities, including awareness campaigns, training and infrastructure development. Legal framework. The Transplantation of Human Organs Act 1994 and its 2011 amendment regulate organ and tissue transplantation in India. NOTT, or the Upsc body for coordinating organ donation and transplantation activities with regional and state level organizations like ROTTOS and SOTTOS. One Nation, One Policy. The NOTP promotes a unified approach to organ donation and transplantation across all states and union territories. Focus on deceased donation. A key objective is to increase the number of organs available for transplantation by promoting deceased organ donation. Awareness and training. The program includes public awareness campaigns to educate people about organ donation and training programs for healthcare professionals. Infrastructure development. The NOTP also focus on strengthening the infrastructure for organ transplantation, including establishing new and upgrading existing facilities. Digital registry. Establishing and operationalizing a digital national organ and tissue donation and transplant registry. Launched by Ministry of Health and Family Welfare, Government of India. Objective to promote organ donation, improve the infrastructure for organ transplantation and ensure equitable organ distribution. Implementation body, National Organ and Tissue Transplant Organization at the national level. Key objectives: increase organ donation rate in the country, establish a network of institutions for procurement and distribution of organs, create awareness among the public about organ donation, train medical professionals in organ and tissue transplantation, ensure transparency in allocation through an online registry. Institutional structure. NOTTO, national level, Delhi, maintains National Organ and Tissue Transplant Registry, coordinates organ allocation at the national level. ROTTO, regional level, coordinate between NOTTO and SOTTOs. SOTTO, state level, maintains State Organ Transplant Registry, coordinate between hospitals and ROTTO. Key components: National Registry for Organ and Tissue Donors and Recipients, capacity building of hospitals for organ retrieval and transplantation, IEC, information, education, communication, campaigns for awareness, financial support to government hospitals for infrastructure. Legal framework governed by the Transplantation of Human Organs and Tissue Act 1994, amended in 2011, regulates removal, storage, and transplantation of human organs or tissues. Allow opt-in consent system in India. Donor must explicitly consent. Recent update. Government working on National Organ Transplant Registry 2.0 for better transparency. Efforts to integrate Aadhaar and health IDs with the donor recipient matrix. Awareness drives like Indian Organ Donation Day 3rd November. Challenges. Low deceased organ donation rate. Myth and misconception about organ donation. Uneven distribution of transplant facilities across states. Shortage of trained transplant coordinates. Vital organs for transplantation. According to Transplantation of Human Organs and Tissues Act 1994, amended in 2011, the following organs can be donated: kidney, liver, heart, lungs, pancreas, small intestine. Tissues that can be donated: cornea, skin, heart valve, bone and bone marrow, blood vessels, cartilage, tendons, ligaments. Donation type: living donor, kidney, partial liver, bone marrow. Deceased donor, all vital organs plus tissues. The question is, consider the following statement regarding National Organ Transplant Program. First statement is, program will organize a system of organ and tissue procurement and distribution for transplantation. This is also correct. One of its aims to protect vulnerable poor from organ trafficking. This is also correct. So answer is C. About National Organ Transplant Program. National Organ Transplant Program aims to promote organ donation and transplantation across all states or union territories. Implementing agency: Directorate General of Health Service, Ministry of Health and Family Welfare is implementing the National Organ Transplant Program. Objectives of the program: to organize a system of organ and tissue procurement and distribution for transplantation, to promote deceased organ and tissue donation, furthermore to train required manpower, also to protect vulnerable poor from organ trafficking, lastly to monitor organ and tissue transplant services and bring about policy and program corrections changes whenever needed. Next question is, with reference to the National Organ and Tissue Transplant Organization, consider the following statement. Statement 1. It is primarily focused on importing organs and tissues from other countries to meet domestic demand. This is incorrect. Statement 1. NOTTO is not primarily focused on importing organs and tissues from other countries to meet domestic demand. In fact, NOTTO has a number of initiatives in place to promote organ donation and transplantation within India. For example, NOTTO has a national registry of potential organ donors, and it provides training and support to transplant centers across the country. It is a national level organization set up under Directorate General of Health Service, Ministry of Health. It functions as the apex center of all Indian activities for procurement, distribution and registry of organs and tissue donation and transplantation in the country. Statement 2. It plays a vital role in ensuring the fair and equitable distribution of organs and tissues for transplantation in India. This is correct. So answer is D. NOTTO plays a vital role in ensuring the fair and equitable distribution of organs and tissues for transplantation in India. NOTTO maintains a national registry of organ donors and recipients, and it also develops and implements policies and procedures for organ allocation.